Flumazenil injection clinical uses. What's flumazenil? Flumazenil is a benzodiazepine receptor antagonist that is used to reverse the effects of benzodiazepine overdose or to help reverse the sedative effects of benzodiazepines during a medical procedure. It is also used to help diagnose and treat benzodiazepine overdose. Flumazenil is primarily used in clinical settings for the following purposes. 1. Reversing the effects of benzodiazepine overdose. Flumazenil can be administered to reverse the sedative effects of benzodiazepines in cases of overdose. This can help restore normal respiratory function and consciousness in patients who have ingested an excessive amount of benzodiazepine medications. 2. Reversing the sedative effects of benzodiazepines during medical procedures. Flumazenil may be used during medical procedures to help reverse the sedative effects of benzodiazepines, allowing patients to regain consciousness more quickly after being sedated. This can be particularly useful in procedures where it is important for the patient to be alert and responsive after the sedation wears off. 3. Diagnosis and treatment of benzodiazepine overdose. Flumazenil can be used diagnostically to confirm the presence of benzodiazepines in a patient who is unresponsive or sedated. It may also be used therapeutically to help manage symptoms of benzodiazepine overdose, such as excessive sedation or respiratory depression. Flumazenil injection dose. The typical recommended dose of flumazenil for reversing benzodiazepine overdose in adults is 0.2 mg to 1 mg administered intravenously over 15 seconds. Additional doses may be administered every minute if needed, up to a maximum total dose of 3 mg in pediatric patients. The typical initial dose is 0.01 mg per kilogram administered intravenously over 15 seconds, with additional doses of 0.05 mg per kilogram every minute if needed, up to a maximum total dose of 1 mg.